Cancer is a very complex disease. It is when a large number of diseases, distinguished by the development of abnormal cells, divide uncontrollably and spreads into the surrounding tissues, resulting to destroy normal body tissues. The cause towards cancer varies, but there are usually genetic factors, lifestyle choices, and environmental exposures. First, changes in DNA, or in other words, mutations in DNA, is a big cause towards cancer. The DNA is divided into large amount of genes containing the instruction on how the cell should work. If errors occur in the instruction, then it stops functioning and therefore lead the cell to become cancerous. Lifestyle choices plays a big part towards the cause of cancer. Lifestyle factors including alcohol, cigarette smoking, diet such as red meat or fried food, stress, physical inactivity, infections, and environmental pollutants. Those who follow this lifestyle end up becoming a victim to cancer. Finally, environmental exposures can lead to cancer as it can damage DNA, including radiation such as ultraviolet rays from the sun and substances such as the chemicals found in tobacco smoke. While genetic factors regarding cancer is much more popular as a topic than both lifestyle choices and environmental exposures, genetic factors are only responsible for 5 to 10% of all cancer cases, while lifestyle choices and environmental exposure is responsible for 90 to 95% of all cases. The symptoms caused by cancer varies on the body part that is affected, but most commonly it is fatigue, weight changes, unintended gain or loss, changes in bladder or bowel habits, skin changes such as darkening, yellowing, or the redness of the skin, sores that won't heal, or changes to existing moles, trouble breathing or constant cough, hoarsenesses, difficult swallowing, persistent unexplained night sweats or fevers, persistent unexplained muscle or joint pain, and unexplained bleeding or bruising. In a research conducted by the National Cancer Institute, the common types of cancer diagnosed in the U.S., excluding non-melanoma skin cancer, are bladder cancer, breast cancer, colon and rectal cancer, endometrial cancer, kidney cancer, leukemic, liver, lung cancer, melanoma, non-Hodgkin lymphoma, pancreatic cancer, prostate cancer, and thyroid cancer. Out of all these common types of cancer, the most common type of cancer is breast cancer, with 300,590 new cases that were expected in the U.S. in 2023. Breast cancer is a complex disease which is characterized by uncontrolled growth of a normal cell, leading to a formation of tumors. If it is left untreated, it can result in serious repercussions, including tumors spreading throughout the body and likely becoming fatal. The development of breast cancer cell begins inside the milk-producing lobules of the breast or the milk ducts. In its early stage, it is known as in situ. The cancer cell remains to be not life-threatening. However, the disease will continue to progress if not taken care of. The in situ can invade into the nearby breast tissues and then create tumors that cause lumps or thickening. While invasive cancer spreads to the nearby organs, metastasize, or lymph nodes, metastasis poses a much bigger and significant threat, underscoring the importance of early intervention and detection. According to the World Health Organization, it is found that metastatic breast cancer carries a high risk of mortality. Breast cancer is the highest risk factor for women, while only 0.5 to 1% of breast cancer occurs in men. It is possible that after a woman gets breast cancer, they might also develop breast cancer a second time. If it is non-cancer, they might develop breast cancer such as atypical ductal hyperplasia or lobular carcinoma in situ. Breast cancer has a combination of symptoms, especially when it's more advanced. Most people tend to not experience any symptoms in the early stage. The symptoms of breast cancer can include abnormal or bloody fluid from the nipple, dimpling, pitting, redness or other changes in skin, change in the shape, appearance, size of the breast, a breast thickening or breast lump, often without pain, and finally, change in the skin surrounding the nipple, areola, or appearance of the nipple. The cause for breast cancer is not fully understood, as it is difficult to say why one may develop breast cancer and another may not. But most commonly, the cause of breast cancer comes from age, family history, genes, and previous breast cancer or lump. First, as a person's age increases, the risk of developing breast cancer gets higher. This condition is seen most common in women over the age of 50 who have suffered from menopause. Second, another cause of cancer is if you have close relatives who have suffered from breast cancer or ovarian cancer. This will result in a higher risk of developing breast cancer. By chance, it is possible to have breast cancer in multiple family members, creating an even higher risk of breast cancer. Third, another cause of breast cancer is when some breast cells grow abnormally. These cells divide more rapidly than the healthy cells do. It can continue to accumulate, resulting in forming lump or mass. Cells may metastasize through your breast to your lymph nodes or the other parts of your body. Breast cancer most often begins with the cell in the milk-producing ducts. Breast cancer can also begin in the lobules or in other tissues or cells within the body. Fourth, the female hormone estrogen can sometimes stimulate the breast cancer cells to grow. The risk of developing cancer increases slightly depending on the amount of estrogen your body is exposed to. Fifth, if a person previously had breast cancer or an early non-invasive cancer cell changes in breast ducts, you would have a high risk of developing it again in the other or the same breast. Lifestyle choices is crucial regarding breast cancer. Being physically active both before and after the diagnosis decreases mortality risk. Diet. High fat intake, especially salted fat before getting breast cancer, increases mortality risk, while eating food that contains soy or fiber lowers the risk of mortality. Women who drink any degree of alcohol results in increasing their risk of breast cancer. If you do ever get breast cancer, a person must take immediate action. They should choose one of the following methods: surgery, hormonal therapy, chemotherapy, radiation therapy, and biological therapy. Surgery is where an operation will take place and the doctor just cuts out the cancer. In hormonal therapy, the doctor will block the cancer cell from getting to the hormone they need to grow. Using special medication, they can kill or shrink the cancer cells, which is called chemotherapy. Using high energy rays, they can conduct radiation therapy by killing cancer cells. Biological therapy process can be taken by your body's immune system to help fight the cancer cell, or it can be used to control side effects from cancer treatment. The treatment that a person should follow must be talked about with your cancer doctor in order to get for your stage and your type of cancer. In conclusion, breast cancer is a very common and dangerous disease. A person must take care of themselves and try their best to avoid getting breast cancer. But if they do get breast cancer, they must follow one of the steps mentioned in the video.